Good morning, everybody. My name is Dr. Ravi Gupta, and I am a consultant pediatrician working at Sneh Mother and Child Clinic in Sector 77, Noida. Today, I would like to discuss with you about a very common problem seen in childhood, that is constipation. Almost every 1 to 3 children which I see in my clinic out of 10 are suffering from this issue. First, let us see what are the common presentations seen in constipation. The child may say that he is having difficulty in passing stools. He may strain at the time of passing of stools, or his stools may be very infrequent and hard. Sometimes it may be associated with blood. Very rarely, especially in small children, you can see that the child is hiding behind the sofa or behind the curtain and he is trying to cross leg himself. That is, he's trying to hold for the stools to come out, which we call as retentive posturing. Other common symptoms could be bloating of stomach, poor appetite, uh, nausea and vomiting, and sometimes we can see poor growth also. Now, let us try to understand what is the reason behind this and what are the causes of constipation. Now, it may be reassuring for the child to know that this problem may be running in the families and it is not his fault. So, all it needs is positive therapy. Other causes could be at the time of weaning, parents are not giving enough water to the child, which can lead to constipation. Also, any febrile illness in which there is a loss of water from the body, and then high intake of milk, poor fiber intake, sedentary lifestyles, and psychosocial factors in the family, and something as common as dirty toilets in the school. Now, once constipation sets in, then what happens is that your large colon starts to absorb the water from the stool, and the stool becomes more harder, and child is not able to pass the stool or faces difficulty, and as the stool hardens, the child experiences a pain while passing stool. So this can create a vicious cycle leading to further holding of stools and further hardening of the feces and further delaying the passage of stools. When you go to your doctor with any of these symptoms, then what can you expect? So your doctor will like to ask you a few questions that might include: when did your child first pass stool after birth? That is the first stool, or which is called meconium or the green stool. He may like to ask about any other health issues, the kind of diet your child is taking, how much fluid intake your child is taking, or mucus in the stool. On examination, doctor may plot your child's weight and height on the growth chart. He may feel your child's stomach, and sometimes the doctor can feel hard stools, especially in the lower part of the abdomen. He may look at the anal area to look for any fissures or any cuts. He may also look at the child's spine to see that the structure of the spine is normal. As regards to the investigations, it is quite reassuring to know that in majority of the cases, almost 95% of the cases, the constipation is functional, and most of the cases don't require any investigation. Only if there are certain red flags like any blood or mucus in the stool, poor growth, any abnormality on the spine or the lower leg examination, history of delayed passage of stools after birth, then only the doctor will ask for any investigation. So, coming to the management, onboarding or the training or teaching of the parents is very important, because parents have to understand that this issue of constipation is chronic and will take a long time to get better. So the parents should not scold the child, they should positively praise the child for passing stool and create an atmosphere in which they help the child to come out of the issue. Second important point is behavior therapy of the child. That means that you have to encourage the child to go to loo after every breakfast, lunch and dinner, and sit in the potty pan, because that is the best time for the gastrocolic reflex, and the child has got an urge to pass this. The child should be praised on passing stool. The parents can keep a a diary, or they can maintain a chart which we call a star chart, and can give small rewards to the child so as to encourage the child. Now coming to the diet, which plays a very important role in the management. Now the doctor may ask you to reduce your child's milk intake, and in some cases the doctor may ask you to stop the child's milk for a few days or week. Increasing water intake is very important. So as a rough rule, a child who is less than 1 year of age should take at least 1 liter of water. School-going child should take about 1.5 liter of water per day, and an adolescent should take about 2 liters of water per day. Good intake of fiber is very important. So this includes green vegetables like cauliflower, broccoli, carrots, beans, peas. Then fruit which are rich in fiber, including papaya, pears, apples, are very useful. Dried fruits like makhana, kishmish, munakka, especially soaked ones, and even dates. After this comes the role of the medicine. Now we divide medicines into two parts. First group of medicines which relieve basically the impacted stools. So they are given for short duration so as to clean out the bowel. And the second group of medications are called stool softeners, which we have to give for a long time, and they help the body to pass the stool by softening the stools. Now one very important point to note is that these stool softeners should not be stopped abruptly, and the therapy should always be stopped under the guidance of the doctor. So to summarize, constipation is a very common problem seen in children. The parents might not be aware that the symptoms their child is suffering are due to underlying constipation, and with right behavioral therapy and medications, the child can come out of it. So with this, I would like to conclude my video, and if you've got any questions to ask, you can write in the comment box. Please do like, subscribe and share this video if you found this information useful. Thank you very much for watching this.